Thank you. Welcome. I will go through some overviews of Covalon, but I wanted to leave you with 3 things that hopefully you'll remember if you fall asleep on me while I'm talking. Number 1, our products solve serious clinical problems in ICUs, surgical suites, and for those who have serious wound care issues. Second is that we're on a really solid financial footing in our core business. And the third thing is that there's some significant growth opportunities for us going forward that I think we're well positioned to take advantage of. There's always risks when you go into a hospital and you're admitted for whatever reason, whether it's you or a loved one. And there's risks of infection. We've all heard of hospital-acquired infections. We all know stories of people, friends, relatives, maybe who've gone in to the hospital, got an infection, had a complication. Some of them don't come out. They die. We hope that if one of our loved ones goes into the hospital, we're treated in a nice environment that looks very much like this stock photo. The reality is a lot different than that. This is your typical ICU patient. This happens to be a pediatric patient. Just looking at that patient, I can see at least half a dozen opportunities for an infection. It's a serious issue. Think about 1.7 million people a year get an infection when they're in the hospital, and every day 274 people die. That translates to be about 100,000 people a year. And it's a big deal. In the United States, those infections are uninsured. So paying to treat those infections comes out of the pocket of the hospital. It's a lot of money. It's $28 billion. You can imagine the incredible crisis situation that exists when those infections over the past year since COVID hit have gone up 63% in ICUs on average across the U.S. So I want you to just walk through a bit of an imagined scenario with me. So suspend the fact that you're all very highly successful MicroCap investors and pretend for a moment that you run a department in a hospital. And you have infections that just went up 63%. You have people dying every day because of those. And the products that you're currently using don't seem to do a good job of managing that. What would it be worth to you to be able to solve that problem? What if there were products that existed that could reduce your infection rates on bloodstream infections and surgical site infections, in some cases down to near zero? In other cases, significantly lower them. Nothing can prevent completely infections from occurring. That saved you about $100,000 to $200,000 a year in your department. Your staff liked because it saved them a lot of time, and they could spend that time treating the patients instead of treating the damage that some of the products they normally use would do to them. And patients actually love them, so much so that they write the company that makes those products and tell them how much they like those products. How much would that be worth to you as a department manager in a hospital? Well, what do you think it's worth to the hospital if it wasn't just one department, it was a dozen that were experiencing the same thing? As an investor in Covalon, what if it wasn't just a department or a dozen departments in a hospital, but what if it's a dozen hospitals? Or maybe 200? That's what our products are capable of in the areas of vascular access infections, bloodstream infections, surgical site infections. And as an investor, what if I told you we also had another set of products that treated just as big an issue in a different area? Would that be worth something? The second problem is chronic wounds.
You said hospitals are responsible for the costs of a
Yes, in the United States. In Canada, it's in many other countries that have single-payer programs, doesn't matter. In the U.S., that $28 billion they spend treating those infections, that's out of the hospital's pocket. The other area is chronic wounds. It affects 1 in 4 families. There's $50 billion spent trying to treat these wounds. It's an area where it's driven a lot by diabetes and diabetic foot ulcers, which I hate to say, because of COVID, a lot of people's activity levels are significantly down, and the diabetic wounds are instances of that are going through the roof. Again, also because people didn't have access to go in to get treatment. So this is another area that Covalon has products that can focus on. Now I warn you, if you're squeamish, the next slide is going to have some pictures that hopefully your box lunch doesn't come back to haunt you. Diabetic foot ulcers are serious things and can lead, if untreated, to amputations. So left-hand side, this was a typical case of an infected wound on a person's foot that they left too long, tried a bunch of things, wasn't working, used our products, 30 days later, completely healed. The bottom right one was actually someone who was, their foot was scheduled for amputation, and the clinician thought, let me just try your product. I had tried everything else. After 6 months, completely healed, saved the foot. And probably saved that person's life, because the chances of dying after an amputation are within 5 years, the mortality rate is probably about 65%. So Covalon has products that take on both of those areas. And when we take a look at where we're sitting right now as a company, I think we are a financially strong base business. We've got $24 million of cash on the balance sheet. We ended our fiscal 2021 with a small profit from operations, and we were cash flow positive from operations. Our revenue is continuing to grow in our key market in the United States, and we're building out our management team so we can take advantage of the growth opportunities in front of us. We have really strong products and really strong IP. And as an investor, I think that's an important thing that's often misunderstood and overlooked, just how strong our products are and our intellectual property are. And that's validated by the clinical support that clinicians give our products. They're publishing data about how successful they are with our products. That story I talked to you about saving the money, about being able to reduce infection rates and 5 lives saved, that's an actual real case that happened at a facility called Texas Children's Hospital. If anybody understands Texas Health Center and Texas Children's Hospital is one of the largest children's hospitals in the world. So we're getting a lot of clinical data coming out of facilities that are using our products and getting great results, and without us being involved publishing their findings. The markets that we're in are huge. And there's lots of opportunity for us to grow. And as I said, we're getting really KOLs, key opinion leaders, supporting our products and getting great results. So we're listed on the TSX Venture Exchange. Market cap of about 51 million. We've got about close to 26 million of shares outstanding. Two things of note: insider ownership is about 55%, and we have about close to $1 of cash per share sitting on our balance sheet, and our current share price is about $1.98. This is where every CEO says their company's undervalued, and I'm going to be like every CEO and say, I think we're undervalued. So taking a look at our financial performance, there's no question we got hit by COVID. Our products are used in hospitals, in ICUs, and in surgeries, and in advanced wound care, and we experienced a decline because of COVID. Since then, you can see in our main market, the dark bar in the United States, the growth has been pretty rapid. We still see the opportunity to go back to pre-COVID levels in the Middle East. It's not our focus, but the business is there, and we've done well in the past. We also see opportunities to grow in the rest of the world, mainly Latin America. When you take a look at margins, there's been a lot of noise that companies had in both margins and operating expenses because of COVID and government subsidies and supply chain challenges. So what we've done in our financial reporting is we've included adjusted margin and adjusted EBITDA to take out all the noise of government funding and all the other impacts. And so when we look at that, our gross margin at the product level is trending in the right direction. I foresee it continuing to go up, and a lot of that is due to the fact that our main market, the United States, we tend to have higher margins on our products. The balance sheet, I think, is one of the big stories. That we went from 2020, where we had about $3.5 million in cash and close to $18 million in debt, to now having roughly $24, $25 million in cash and no debt. So what's going to drive our growth? The story I talked to you about is one example. There's a lot of text up here, but I'll try to summarize it. One area that I see really strong growth for Covalon is in our hospital business. Last year, a year ago in end of July, we sold one of our non-core products called AquaGuard. It had no intellectual property. It had no barriers to entry for competition. We sold it for $38 million. We have lots of opportunity with our current products in the hospital market. We retained a core team from that AquaGuard business to focus on hospitals, and we've begun the process of engaging with those facilities, and we have roughly 200 hospitals right now as customers. It's the 80-20 rule. So we probably have about 40 or 50 of those that I would say are major influential facilities, like Texas Children's, like Johns Hopkins, and many other facilities that are using at least one of our products. And there's significant growth opportunity for us in that space. The second area is our collagen dressings that are targeted at diabetic foot ulcers in the United States. We're seeing tremendous growth there, and I do foresee that continue on the upward trend. One area that I didn't talk about is an area of our business. We are known worldwide in our space as antimicrobial experts, and we're hired by companies to take existing products that go inside patients as catheters or other implantable devices and turn those into antimicrobial products. That's through our medical coatings business. Small part of our business right now, but also has some opportunity for growth going forward. So I truly think we're poised for growth. We're well funded and debt free. There's a significant need for our products in the market. And I think we have solutions that can take on the challenges that exist. The demand is there for products that can close these wounds that just won't heal by themselves. And we have one of the very few products that can actually do that effectively. There's a funny thing that's happened in hospitals and with clinicians since COVID has hit. And all of a sudden, there's no patients left for products that cause complications, cause damage, cause them to spend more time on things that are not related to getting the patient better. And so clinicians have just demanded in their facilities that they get better products to treat infections and better products that are safer for patients. And we're seeing that in ICU, and we're seeing that in the surgical arena. A lot of the political barriers that used to exist have been trumped now by clinical need because of the strains on the healthcare system. And we're proving ourselves with the most vulnerable patients in children's hospitals, in oncology centers. Those are the most challenging situations. It's a lot easier to step into mainstream hospital, mainstream ICU, once you've proven yourself in the most difficult areas of medicine. It's harder to go the other way. So I truly think we are poised for growth. So what are our products? And again, maybe I've done this all backwards. Most companies would start with what's inside your box. I wanted to tell you about what happens with our products in the market, but we have some really good products. So we have the world's only dual antimicrobial surgical dressing. And that's actually one of the patients that had open heart surgery at one of the hospitals that benefited from our dressing being on top of their incision and helping to prevent infections. We have the world's only dual antimicrobial IV silicone release dressing. That's a game changer for those in the vascular access area. We have the only vascular access line-to-line connection barrier that currently exists. We launched that about 8 months ago and seeing a lot of interest. And it's hard to see there, but it's basically a device that goes on, a real simple device that goes onto vascular line connections to help prevent them from getting contaminated. And really simple, have a patent application that's pending on it, but it's really taken a lot of key facilities by storm, and we really like it because it solves a key clinical problem we have. We have the world's only collagen wound filler that has antimicrobial silver. We also have an entire portfolio of other products to go along with it. So as a small company, there's a lot in our box. A lot of that is driven off of what I would call our platform technologies. And this is a part of what's under the covers of Covalon. We have really strong intellectual property to support what I think are 3 really strong platform technologies. Our antimicrobial silicone adhesive technology is one of a kind in the market. And we've got really strong IP and great products that are truly having a major impact on the clinicians and the patients. Our advanced wound care, our Collective Plus biological collagen, again, very strong product. It has helped thousands upon thousands of patients a year to help their wounds heal. There's a lot of clinical evidence to support from it and very strong IP. And we have a very strong medical coatings platform. This is just one of our taglines. We also protect from the inside out with our medical coatings. The other thing is that we're really well respected in the medical device industry. We work with a lot of big companies. They either make products for them or they distribute our products because they don't have anything like it. And that's one of the aspects of Covalon that I'm really proud of is our reputation within the space. It means nothing unless the clinicians and patients who benefit from our products can truly benefit. I get letters, I get stories from patients that come through email telling us how they went in for their leukemia treatment and they took the time out to send me a note to say, your dressing fundamentally changed the course of my care because it didn't have the complications and pain and damage that the competition does. It's incredible that this is not even why they were admitted to the hospital. So that's something that's quite unique about Covalon is the support that clinicians and patients give the company. This was a social media campaign that was done by one of the facilities on their own. Happened to feature our dressing in every single element of their campaign. So again, I'll leave you with the three pillars. I think we're very strong financially, our core business. We have really strong IP innovation, and I think we're very poised for growth. Happy to take any questions. I also have this presentation on a QR code that I can make available after the presentation.
Two quick questions. One is, do you compete with SEDAR?
Sorry?
SEDAR, MedCap?
SEDAR MedTech. They have They do. They have a wound care collagen powder. They also have a surgical powder. We have an antimicrobial version of that. So we do compete in a little bit, but we don't compete currently in their surgical side.
Okay, so talking about competition then, who is the 800-pound gorilla?
A small startup company called 3M.
You go up against them?
3M, Johnson & Johnson, Medline are probably the big guys that we have to displace.
I assume the cash, that's from selling off there, right?
That's correct.
There was no capital raise.
That was without dilution. So we went from a balance sheet that had significant debt, a little bit of cash to a lot of cash, no dilution.
Did you mention about like growing the management team for the growth? What do you have to do there? What do you expect that will entail in terms of like conditions that you make?
We've already started. We've hired some really key senior executives that have experience in the infection prevention market and in wound care. They've joined us recently. And we also, we'll build out our sales and marketing teams. We've got enough products. We've got enough technology. We don't need more of that. I think part of your question is also what are we going to do with the cash? I see an opportunity to look at tuck-in acquisitions and inorganic growth. We've demonstrated we can buy things and sell them for significant profits with the AquaGuard product line. And so I see that as part of our opportunity as well. Well, thanks very much. I really appreciate you spending the time and happy to make the presentation available to anybody who wants it. Thank you.